Hello, everyone. We will be discussing which of the following components I believe to have the greatest impact on motor behavior. The components are motor control, motor learning, and motor development. Um, in order to answer this question, I would like to pull back, the definitions in Chapter 2 to make sure we clarify some things. So, motor behavior is defined um, in the manner in which the nervous, skeletal, and muscular system um, interact to produce skill movement. Okay, so the components that affect motor behavior are motor control, motor learning, and motor development. Motor control is defined or has to do with how the neural structures um, that are involved affect motor behavior and how they produce movement. All right, so chapter 2 breaks motor control into different components, right? It breaks it down into sensory, proprioception, muscle synergies, and sensory motor integration. These are things that improve motor control, and chapter 2 goes into detail about those things. Motor learning has to do, how individuals learn movement and retain that information for future use. So this addresses motor learning, through practice and experience is how motor learning is learned, I guess you can say. And then chapter 2 breaks it down into feedback, into the component of feedback and how internal and external feedback affects motor learning. Motor development, it's kind of hard to define. Chapter 2 defines it as motor behavior over time through one's lifespan. For me, that's kind of broad. I like to think of it as motor control and motor learning combined to affect to create motor development, right? So over time, if you address motor control, motor learning, you will increase in skill and performance. That's the idea, and that's how I would define motor development. As far as which one has the greatest impact on motor behavior, I would say it depends on your patient and your patient population, um, because every healthcare and exercise science or just just exercise in general should be individualized. So it honestly depends on your patient population. For example, a young athlete will have different restrictions or different requirements in their life compared to an older patient, right, who's more sedentary in nature, for example. So for me as an athletic trainer, my patient population has, I emphasize motor control. Um, you know, Specifically on proprioception, right? Knowing where athletes are in space. Because as an athletic trainer, we're more focused on injury prevention, right? So if an athlete knows where they are in space, they're less likely to injure themselves, right? It's just knowing where you are. And research has shown this with ankle sprains, right? If proprioceptive training has benefit, proprioceptive training can decrease the incidence of ankle sprains in patients with previous history and non-previous history. Therefore, I would say, in my opinion, as an athletic trainer, motor control is um, where I see the greatest impact on motor behavior. However, motor learning is also very important, especially for your older population, right? Depending on what conditions they may have, they just learn through practice and experience. You may tap into motor control for sure, but the practice and experience has to do with motor learning and just learning it over time. As an athletic trainer, we'll also see this with post-surgical injuries, but where it's just repetitive, treatment and exercise, because we want to learn things to eventually jump to motor control. So again, I think motor control is probably the biggest or has the greatest impact on motor behavior. Thank you, guys.